bois. Ali nyong wali ako. Le machine ou la fou. Tu as mis le bois. Et puis faut voir l'embou, mais le bois. Bon tu l'as un bout d'indem. Il y a pas pour le fort. Moi là vous venez pour le fort dans une peine. Vous pas pour le fort, vous monter indem ça. Aïe indem bé. Dem moi dem pas pour
We get team where LECUDO-USA send a here for can take care for una. We there up to 30 people or more. We get people there where the doctors where they walk around Cameroon when some them are Lebang Peking, some them not be not. We get Life Bridge International. He go give you what? Now Mr. Nkweta Richard represent them. When a LECUDO partner. We get Healing Beyond the Horizon. Their representative there go talk one word to now when them join LECUDO for send the free medicine we will go get them, and then we'll get so other people where they join them will they come for that one. We'll get other people where they join them, particularly Healing Beyond the Horizon, where they only give medicine, they give some money. We'll get some goodwill sons and daughters of Lebang, like Mbe for Jong too. He sends some money where they go use them for do free operation. So now all them join LECUDO-USA, they combine for see when I see all we there here today. So we'll clap hand for them. When you enter, they will do you plenty things there one time. Not be until unless you get reason for come back tomorrow. The one the way they pass today will arrange say all things you need and go be available today. Now only person we go need operation. Where they keep it for tomorrow or after tomorrow or 90-day follow-up. Number two, I want to know say some people the day where their problem they not go fix over now. Not give up, they go explain for you. Some people the way if they see and they not fix up your problem, they go give you 90 days appointment, 3 months. Thank you very much.
Me monkey al and the bucket tongue if my algo no at the great mago etung is so that fair conte it will be bon fianga ama for young angle that fair conte it won't go be America it be man cap non tun begambo football free then you go tako yi bo fa du bo moment team bon in the mafia gap mbomo nkonze bo bon bo ela le ngba agimo bo tun cap les blancs jouent bon donc comme qu'on et la fort le bon groupe et bien j'aime bon bouger bon bien tout le monde fou tout le monde docteur bon bouger bien aller bon nam tu veux bien bien fier je suis un bon bon côté nous on a comme bien dire bon pour un tout petit boulot ça va se bien bon contact
mbanga foza bo fa bi e fieta wo mo nganga zingiri prazo azingiri mamba foza mo mba minti nga afuzu abuyi ntang dam nga dama chute afuzu abulu woye ambiwo c'est fort c'est make a time for now a time the people where they organize these doctors and see they can help the people where they so where they run a war and they die mama for ya ngal for aga ndi ya ga ni wo back. Sometimes we go to one room or the channel
just for women, or just encourage them, be they like take upon themselves so can do this screening or get all the things they don't put that in place. Or if you handle the things where if it cause you cancer in future. Thank you. Thank you.
Dr. Etienne Asongani, I lead a team of medical personnel where they come around Cameroon. We don't come here for Chang, for can look at internally displaced persons the way they come out down the BLM during the conflict. As we there, so we do them free consultation, we do them free treatment, we do them free cancer screening, And the one where they do cervical cancer, if we see lesion, we dey treat them. We dey do biopsies for lesions, then we'll see them. We dey do echography for free. We dey do lab tests for them. And we dey do pediatric, we come with pediatrician, we dey do a lot of pediatric work for picking them. And lastly, we get mental health expert, we dey do counseling, and then we dey look out for post-traumatic stress disorders among the people.
Yes! I'm there.
126.
LECUDO-USA bis na assist any organisation where you bis na vele butenagate ale make sure le buton number wo fiwo number o kondi anga konsom doctor bi fiam number wo kan ambo kan bi wusen fura wo nga be be nton chuge kondi nga on konsom so mo fu mbela to mo le bangbo bison yenga mambo bele bang chi obinjem so agro position bi lon ten agro be dem to job bi won come
What I'm doing here is I'm taking the vital sign of the patient. When I take the vital sign, I send them for another process.
And here is the OPD. We take parameters for patient, then we send it to the triage.
Patients are allocated the different sections of the hospital where they are actually wanted to be consulted or taken care of. So in simple terms, triage, if there's an emergency, we'll send to the emergency department. If there's a child, we'll send to the pediatrician. If there's a surgical case, we'll send to the surgeon. If there's a general consultation, we'll send to the GPs. If there's a diabetic patient, we'll send to the diabetologist. If there's a patient with a heart problem, we'll send to the cardiologist. So that's all about triage. Sending the patients to their appropriate places so that their care is being taken care of. I will prioritize always the emergency cases because those are the life-threatening cases that need to be attended to as soon as possible. Attending to all the threatening disease conditions that we have here. Remember, we're in an era of COVID, we're in an era of cholera, and I also do general consultations and basic and major surgeries.
Consultation rooms for the LECUDO health campaign for the internally displaced people from Lebanon. So here we are doing general consultation, and in case we find it necessary to send a patient for laboratory workups, from here patients go to the lab. Then from the lab they come back, and if we make a diagnosis, we send them down to the pharmacy with their medications for them to collect, and we give them rendezvous over the next week to 1 week to show up in the clinic for a follow-up.
This is my workstation. I must say that this is not the only gynecologic workstations. There are other gynecologists who have workstations. But in this workstation, it's essentially a bit complicated. We have 3 major activities. We have gynecologic consultations per se. We also have a cervical cancer screening team that are here, and they need to be next to me because I supervise them. When they have dubious lesions or dubious observations, I'm the one to clarify them and give them a way forward. That's why they must be next to me. Apart from that, we also have our mobile ultrasound clinic here. Those who need ultrasound from other doctors, they also need to come here, and I will do the ultrasound. We agreed because I'm the one who can manipulate the machine better. And then for those who will finally be seen with lesions at the cervical cancer screening, we have our thermocoagulator machine. This is the machine that replaces what was formerly called a cryotherapy. It is used to treat low-grade lesions from a VIA-VILI cervical cancer screening. So those who have low-grade lesions, they will have treatment here and now. Those who have high-grade lesions, they will probably be programmed for biopsies, or they will come for a LEAP. That will be according to the 90-day follow-up, which one of the LECUDO partners, Healing Beyond the Horizon, will be determining from the data that we will send to them from this program. Thank you very much.
When the patient comes to me, even though they have done the triage, I've screened them and see what their vital signs that they collected. I still ask the questions that they have written. I ask their problem, why they are here, and if the problem is something that I can handle, I handle. If something that I need to send them to the lab, I send them to the lab. If it is something that I just need to put the right prescription, I do. So it depends on what I ask and what the patient tells me. Sometimes they are unable to explain themselves very well, but we need to ask questions in such a way that they can understand and know exactly what we want, so that if we have any problem that they cannot resolve, then we know where to move forward from there. Vincent. Jenny, Christina. Yes. Christopher. Chibeli. Yes. Chibeli.
The second was a cervical polyp that was taken out by the gynecologist. The third was a lipoma. This morning we'll be doing a hydrocelectomy, and here is the setup of our theater. You see that's the oxygen cylinder with the part of connected to the ample bag, and is used for resuscitation of the patients by the anesthetist. That's the anesthetic session where we have all the kinds of anesthesia, up to high-lutein, we have spinal, we have both general and local. Those are the equipment that I use generally. This is a slit lamp which is used to point the light of the patient and will show that the patient will be able to view the tissues. This is a suction that is able to suck out blood from the patient so that it doesn't spill out on the ground, and obviously so that it's not left in the abdominal cavity and will prevent hemoperitoneum. That's it from our end.
We've done 3 major surgeries on children below 16 years. We've done 2 umbilical hernias and 1 inguinal-scrotal hernia, though it was for hydrocele. And today we are carrying out a major surgery. We have a myomectomy to be done.
metformin, we dispense about 5,000 tablets. For the omeprazole, we dispense about 1,000 capsules. And also for the ciprofloxacillin, we dispense about 5,000 capsules. And some drugs got finished. So this morning they went and purchased some, like the cipro and amoxicillin. So they just brought it now for, they are waiting for prescription to dispense to the various patients.